Days after Ontario reported an alarming rise in measles cases, the chief medical officer is addressing the outbreak and the urgent need to get needles in arms.
We are doing well, but we do have gaps and we have to work on those for sure.
The province saw its sharpest spike in measles cases since the outbreak began in October, with 223 new infections reported just last week. And we're now hearing from Ontario's top doctor, Kieran Moore, who appeared on breakfast television to promote vaccination.
It is such a safe, effective vaccine. We have 50 years of history of safety with this vaccine, and it's almost 97% effective at preventing measles after 2 doses.
This comes amid criticism from opposition parties and some doctors who suggest the provincial government should be taking a stronger approach to tackle the measles crisis. Aside from written statements and rare one-off interviews, the chief medical officer has also mainly been absent from the public eye. And this had the Minister of Health defending Dr. Moore's hard work and leadership on the outbreak during a news conference last week.
We have restarted a public education campaign that, frankly, was a recommendation of Dr. Moore to make sure that parents and caregivers understand the critical importance of getting that vaccine.
Right now, our province is the country's measles hotspot, with pockets of southwestern Ontario among the hardest hit. There are now 1,243 confirmed or suspected cases, and the vast majority are in children. According to Public Health Ontario, 95% are unvaccinated or have an unknown status.
The level of spread of measles at this point has really expanded out beyond what most of us, government and those looking at it, would have expected.
Toronto doctor Fahad Razak calls this the worst measles outbreak in a generation and believes disinformation about the vaccine is being fueled by the U.S. government and social media.
So parents, and I really believe as the parent of young children myself, that parents want to do the best for their children. So there are unfortunately many parents out there who believe that the best for their children is to leave them unvaccinated. Many of us would say that this is a very strong argument, an example for why Canada needs to have a very strong autonomous voice, including the way that we communicate information about risk.
Measles cases are now being reported in 17 Ontario health units. Since the outbreak began, 84 people have been hospitalized, including 63 children. No deaths have been reported. Shauna Hunt, City News.